of the same thing. So it gives you the opportunity to attend 2 sessions. So you can attend this session now, and then after we finish this session, if you want to listen to the session again, you can, or you can go to the next session. So I'm really excited about moderating this lecture, and we have 2 well-qualified health professionals from our community who will kind of be leading this discussion and providing a presentation, and then we're going to open it up to you all for question and answers. However, before we start, I kind of wanted to open it up with a short video for you all. Screen. So if you could all give me one. Okay, commit. Share my screen. Alrighty. So I hope that you all can see my screen. And we're gonna start with this short clip.
In a Baltimore neighborhood hard hit by COVID-19, the Reverend Terrace King preaches to a skeptical audience about the new vaccines.
I'm not gonna be a guinea pig.
And so you're definitely not gonna be the first one in line.
King trying to overcome deep mistrust while at the same time pushing health officials to make the community a priority.
This is critical for this community to really make some inroads that can impact our longer term health.
With COVID nearly 3 times more deadly in Black and Latino communities, leading African-American medical professionals also speaking up.
We are urging our community to take safe and effective vaccines once available.
For the minority communities to get access to the vaccines in an equitable way is very important.
Dr. Valerie Montgomery Rice agrees with the CDC panel that healthcare workers should be a priority, but not just doctors and nurses.
There's a significant number of Black and brown people who work in those facilities and who work on the front line.
So we're talking about a very broad definition of healthcare workers.
Yes.
Each state decides distribution details. New York promising equity.
This has to be an inclusive process. The Black, brown, and poor community has paid the highest price for COVID.
And to help show the vaccines can be trusted, Dr. Victoria Smith at a hospital near New Orleans volunteered for a clinical trial.
I wanted to be a model for my patients.
She's not alone. Some 30% or more of the participants in 2 clinical trials are from minority groups after stepped-up outreach. Do you think there's going to be acceptance?
Many of my patients who have had been affected by COVID, losing family members, I think are a little bit more likely to accept it.
The CDC will release guidance once the vaccine is authorized. Ron Allen, NBC News, New York.
Always be ready to seize the...
Sorry. So we know that a vaccine, two vaccines have been approved. And I'm just going to introduce one of our presenters. So our first speaker will be Dr. Abdul Fatai Ajibola Ilukweju. Dr. Ilukweju was born in Ibadan, Oyo State, Nigeria. He received his bachelor's of dental surgery from the University of Lagos College of Medicine. He then relocated to the United States and obtained his Doctor of Medicine from Boston University School of Medicine in Massachusetts. Dr. Ilukweju received his master's in public health from the University of Alabama, Birmingham, Alabama. He's a board certified anesthesiology, and he currently serves as the chief of anesthesiology in Lemuel Shattuck Hospital in Jamaica Plain, Massachusetts. Dr. Ilukweju will be providing us a brief overview of COVID-19 vaccination and a historical context about research in minority populations. Dr. Ilukweju, you can go ahead and start and share your screen with our community members.
Assalamu alaikum. Alhamdulillah Rabbil Alameen. Assalatu wassalamu ala ashrafil nabiyya wal Musalim. I welcome everybody to this session of a platform today. And the topic, like Sister Zulika told us, is COVID-19 and vaccinations. This time last year, if we think we will be in this position we are today, we will be surprised if somebody said, oh, by this time this year, this will have happened throughout the year. You will look at the person and say, what's he talking about? This time last year, we're having platform. Everybody was happy. There was no sign of any disease or any illness anywhere. But for the past 11, 12 months, we've gone through a lot in this community. A lot of misery, a lot of death, a lot of financial loss. And this is where we are today about this pandemic of coronavirus. Some years ago, like 2007, 2005, 6, 7, there was a SARS virus in the Eastern Asia area of countries like in Hong Kong and China, which was severe, but the rate of death and the affliction was much less than this one. So this was a true big pandemic. And before we realized what was going on, our hospitals are filled with people dying, sick, on ventilators, which is unprecedented. We've never seen this kind of thing before in a long time. The US Department of State have been working with everybody, trying to give us information what's going on about this virus. And we all know what the virus is, coronavirus, SARS-CoV-2, and the disease is COVID-19 disease. Now, we've had epidemics before in the past, or pandemics in the past. What are the things that was done to get rid of those pandemics? What are the things the medical establishment were able to do, were able to accomplish? We will get to that one by one. But this disease, if we look at the progression of the infection and the death rate just in the US alone, as of last week, the total number of cases of infection was 17,500,000. And there were total deaths of 315,000. This has increased in the last few days. And we look at the way it goes from April, 500,000 to 2 million in June, to 6 million in August, October, 12.5 million. And then the death rate too went up exponentially. We had a respite of infection around, say, July, August, and then start coming up again. Now we are back up again. So what can we do to prevent ourselves? The CDC gave us guidelines on what we should do to stop the spread of the germs, which is social distancing. Stay away 6 feet from each other, at least 6 feet from each other. Cover your cough when you cough or sneeze. Wear a mask in public. Try not to touch your nose and face and mouth when you touch some surfaces. Clean and disinfect areas which people are touched frequently, constantly. Stay home if you are sick, and wash your hands and sanitize as frequently as possible. I can say categorically that this has helped us a lot. There's a lot of improvement in our hygiene personally when we do this. And the rate of infection has been reduced because of all these steps. And we need to continue to take these steps. Now, what is the solution for this menace of the pandemic? The information we have is that we have to have a vaccine or treatment. The medical establishment has been working since the beginning, since February. They've been experimenting and trying to get some medication to help. A lot of medications have been discovered to try to help. We use steroids, we use remdesivir, we use some other medications. None of them has been shown to be actually effective in treating this disease effectively. But individual immunity and support of immunity has helped a lot of people. People who have very good immunity has been able to survive it without any problems. But people with less immunity has suffered the scourge of the disease. But among our people, African Americans, immigrants, people of color, there's a mistrust in the medical system. And this has some foundation. Where is it coming from? Historically, what's been done to us make us to be skeptical about what they're doing now. And that's why all these controversy theories is flying all over the internet. The ones that I know very well, the Tuskegee experiment, which was in Alabama, where a number of Black people who are infected with syphilis were told by the federal government that they will not take care of them, give them free care to treat their ailments. But they were not treated. They used them to experiment the stages of development of syphilis, from primary to secondary to tertiary, and then death, many of them. This has been a very big issue with African-American population and us too. And that's one of the reasons why people are always very worried about the medical system and how it's done. But that's not the only reason. In North Carolina, in the 60s, there was an eugenics program that was done. The intention of people initially was that people who have genetic problems or who are sick or mentally ill to be getting rid of. But that's not the people they were trying to get rid of. They were trying to get rid of Black people too. So a lot of things were done to sterilize people so they cannot reproduce. So a lot of people were sterilized in the South then. Some of them with hysterectomies, some of them with vasectomies and stuff like that.
Hey.
So that's another area. And there's been a kind of a cop-out on that because President Clinton actually apologized for this back in 1997 for these maltreatment people. And some of these people were actually paid some compensation. I can't remember how much they paid them, but that's not enough. And close to home in Nigeria, in 1996 in Kano, there was an outbreak of neurospinal meningococcal meningitis. And Pfizer went over there to do a trial of their antibiotic, Travlon, which is trovafloxacin. But you see, before 1996, we know there are antibiotics that can take care of this meningitis, which were available, ceftriaxones and some. They were actually capable of taking care of the disease. But Pfizer went there and they did an experiment using the Trovan and then the ceftriaxone. They did not give them the full dose. They gave the kid like a quarter of the dose that is needed for the treatment so that they can show that their medication, trovafloxacin, actually is equally effective. So they can put in the market. And in the process, I think about 11 kids died in Kano before they stopped the experiment. And this went into court. It was a big court issue, but because of the things in Nigeria, the way our people behave, our government, they went and settled out of court for about $70 million or something like that. The case should have worth probably like $50 billion for Pfizer, but the leaders we have in Nigeria who are looking for quick money took $70 million. So other than that, there are a lot of health disparities in the US healthcare system. If you're in healthcare, if you look at the indices of people who are sick, just mention the disease, whether it's diabetes, hypertension, whatever, and you see the kind of care they get and how they get it, you'll see how these inequalities and inaccessibility of healthcare. Access to healthcare is difficult for people, not just because of geography or where they live to the area where the health centers are, financial access, and political access too, because some people are prevented from getting into the healthcare system by ways of politics. So those are the issues that we face, and that's why all this feeling of not believing what's going on, thinking these are a kind of a plan, a diabolical plan to get rid of Black people is coming on from the internet. And that's why if you look at the first video that was shown, the woman was explaining to us that we are part of this, we should be able to prevent ourselves. And that's why the issue of vaccine is very important for us to follow. So the Tuskegee I was talking about, this is was a US Public Health Service who did this. So what they did was to just look at the history of syphilis untreated to see what happens to people. And that's what they did at that time. This is a picture from some of the studies. They go there into the rural area, claiming that they were treating the subjects, but actually what to do was drawing their blood and analyzing their blood to see any changes as the disease progresses. So that's the background of the misunderstanding or misbelief and the conceptions that go on in the healthcare system with African Americans and the US government. And I cannot blame anybody who have any kind of misgivings or doubts or second thoughts about a vaccine being produced. We have to look at it, we have to analyze it ourselves to know actually that is actually something useful for us and for our people before we allow it to be done. So what is the solution? To us, vaccination is not new. Jerry Joseph from Nigeria. If you are young, you know you've taken some vaccination before. Smallpox was a very, very bad disease, killed many people. It used to kill about 25, 30% of people when inflicted. We got rid of it with vaccine. We had vaccinations. Some of you are in Nigeria then will know that if you have to get smallpox vaccine before you can go to school. If you don't have the vaccine, they won't let you go to school. Not only smallpox, there is chickenpox, which is not as deadly as smallpox. Also, there's a vaccine for it. There is vaccine for measles, mumps, rubella, which one time or the other we must have received. So the issue is vaccine new to us? No, it's not. We've been taking vaccines before. In fact, what we get now is much, much simpler to take than what we used to have when I was a kid. But I'll get to that later. So what is the need for the vaccine? The need for the vaccine is to get something in our body that will help us produce enough antibodies against these organisms so that disease will not take place. And so when we do that, what happens? When we have an immunity, if somebody is sick, we will not contract the disease. And if many of us have the disease, and I'm sorry, if many of us have this vaccine and we are not immune, the disease will have less chance to spread. And that's the idea behind herd immunity. When they say herd immunity, it means the population is immune to a disease. It's a concept which everybody is protected because the threshold for the virus to take place is no longer there in the society. So to get that level in the society, in the community, you have to have at least 70% above of people immune against the disease. That is either vaccinated or had the disease and have now antibodies against it. And that's what the concept of herd immunity. So as for the vaccines, the different substances they use, usually it might be a part of the virus causing disease, or maybe a substance in the virus itself, or another virus similar to that virus. Some of them might be live virus, some of them might be attenuated, which means they've been killed or reduced in power, and they use it as an agent to cause the body to produce antibodies. So as a kid, everybody has immunization records. They'll show you what records you have when you got your smallpox, when you got your tuberculosis injection, and all those ones. And like I was saying, the vaccine we used to get then was very fearful when I was young, because it's not just a single syringe and needle they'll give you. It's a big thing, which I'll show you. Now, issue about vaccination. If you look at this map I have on the board right now, there are different epidemics in the world. The flu of 1918 is up here. Diphtheria, whooping cough, tetanus, polio, Salk polio, Sabin polio, measles, mumps, rubella, hepatitis B, and so on. Now, to just give you an idea, you remember the polio vaccine of 1955 in this country, when people were having polio, Dr. Salk came up with this idea of this injecting the attenuated polio virus. And actually, the vaccine was effective, but 15% of the population who got the virus and who got the vaccine actually developed polio. Because it was an attenuated virus, some people with low immunity do develop the disease. So vaccine is not always safe. It's not completely safe. There are some effects which can happen with the vaccine, which we have to be careful about. And that's why knowledge is very important for us to know exactly what is the vaccine they are giving us and how is it going to work in our body? How are we going to react to it? This is a typical vaccine you get in Nigeria. It's like an AK-47 gun. And you get this for TB, for anything. And then we used to be very scared at that time. But then alhamdulillah, we all survived it. But now today, what you have is just a little syringe, a little tiny 25 gauge needle, which is like a mosquito bite, and that's it. This explains what herd immunity is. If you look at the slide here, all these people who are blue here are healthy, they have no disease. The red two are the diseased people. So when disease comes in, become contagious, the more and more of it, people you see that. Then anybody who is immunized is yellow. So the more you have more people who are immunized or who have had the disease, the more yellow you have, the less chance you have for the disease to now infect other people. If you look at the circles there, see the red one here, surrounded by yellow. It can only infect the guy in blue here, which is a distance away from him. If he's not infected, after a while, the virus dies away, and that's why social distancing is very important. And here, if you look at the one on the lower on the right, the spread of the disease is now contained because we've had what we call a herd immunity. Majority of the population is yellow, which means they've been exposed of the herd vaccination. So for COVID, our government, when the issue became a problem, they formed a committee which they named Operation Warp Speed. And the purpose of that is to kind of speed up the process of investigation, discovery, management, and production of vaccine in a safe and effective way, and then to be able to deliver it to our population as quickly as possible. There's nothing sinister or strange about what Operation Warp Speed is about. There are so many videos on the internet about OWS is some kind of idea to exterminate our population. It's nothing like that. Now, so we have the COVID-19 vaccine now. So far, we have 2 of those vaccines approved. The one from Pfizer, BioNTech, and the one from Moderna. Both of them, from the research and the result we got, are equally effective. They are supposed to be 95% effective. So either one is fine. You can take either of the vaccine, it doesn't matter. So what is in this vaccine? Yes, it's an mRNA vaccine. What they do with this mRNA is that the virus was extracted, and they look at the proteins in the virus. There are 29 proteins in this virus. And the one on the spike of the virus, spike protein, which is the one that the virus used to attach to human cell, it's called the spike protein. So they now take that spike protein and decode it to find the sequence of the amino acids in it. And that is the mRNA part of which they use to make this vaccine. That strand of mRNA has some amino acid on it, and this can be synthesized in laboratory because they know exactly what they are. It's just like when they're doing DNA sequencing to know what are the amino acids in the DNA. So they took it and went to the lab and now pick up this amino acid, whether it's leucine, anti-leucine, threonine, whatever of the amino acid that the things, if you remember DNA sequence, the double-stranded thing, there's a AT, GC, adenine to thymine, and cysteine to threonine to form a strand. So that's the piece they pick and develop that in laboratory, and that's what they use as the base for this protein, for this vaccine. All they did was now put a phospholipid formulation about it. So that formulation of the lipid formulation, that was the difference between the Pfizer and the Moderna one. The lipid particle the Pfizer people use is not as stable, so it has to be cooled below 70 degrees, whereas the one for the Moderna is a little more stable, and that's why with minus 20 degrees is still okay to be used. And those are just the difference between the two. Otherwise, they're basically the same kind of vaccine. So what does it do? When it gets to your body, it will induce antibodies that will block entry to the SARS-CoV-2 CoV-2 virus into your cells. How does it do this? When the vaccine enters the body, it's a strange protein. The body will recognize it and then send the macrophages to go there and say, what is this guy doing here? Who is this? We don't know this thing. So the macrophages go there, surrounds the strange protein, and then the B lymphocytes will now come and look at it, analyze it, and start to produce antibodies against it. At the same time, the T lymphocytes will recognize it as something foreign, so in case it comes back. In the meantime, the macrophages destroys this foreign protein, which is the vaccine coming in. But at the same time, but by that time, the body is making antibodies against it, and then the bodies have recognized it. It is not a virus, so it cannot reproduce itself in the body. What it did was that it stimulated the body to produce antibody against something that looks like that. And the virus just looks like that. And that's where it's going to protect us from the virus. There are a lot of people saying that, oh, it is incorporated into the DNA, it goes into your nucleus. No, it does not enter your nucleus. It gets to the body, surrounded by the macrophages. It is recognized by the B cells. They form antibody against it. The T cells come in, recognizes it. So the body now makes antibody against it. If it comes back again, say 2-3 weeks along the road, immediately it comes in, the T cell will recognize that, oh, this was a bad guy that was here last week, let's attack it. And that's why the body generates more antibodies against it. Basically, that's what the simple explanation of the vaccine is.
Dr. Lukweju,
yes.
Sorry, if you have like one or two more minutes, please.
Okay. So these vaccines have been tested rigorously and safety for safety people being authorized to use. The technology is not new, and it's not new either. It's been used to do some studies in management of some cancer disease for the past 10 years. It does not have a live virus, like I said, so it will not cause a disease in a vaccinated person. It does not enter the nucleus of the cell and does not affect any or interact with patient's DNA. Administration, there are 2 doses series, 3 weeks apart. Intramuscularly, you have to take the two doses for it to be effective. A single dose has not been systematically evaluated to be effective, but what I heard is that after a single dose, you probably have 50 to 60% protection. Then the second one will complete the full immunity. So, recommendation from the public health department: no vaccine is 100% effective. In general population, it will reduce disease severity and transmission, but we have to continue to do what we've been doing: wearing a mask, social distancing, avoiding crowds, washing our hands frequently, and follow all the guidelines we have from the CDC. So basically, that's what I have for you. May Allah guide all of us and protect us and guide us. Amen.
Amen. Jazakallah khair, Dr. Lukweju. Our next presenter is Dr. Adiola Oke. Dr. Adiola Oke is as well a lifelong student and well-trained expert. Dr. Adiola Oke is from Ijebu-Ode, Ogun State, Nigeria. She received her Bachelor's of Science in Nursing from the University of Maryland School of Nursing, as well as her Master's in Public Health from University of Maryland School of Medicine, as well as her Doctor of Pharmacist. So Dr. Oke is actually a pharmacist who her expertise is ambulatory care and chronic disease management. She currently serves as a primary care clinical pharmacy specialist within the primary authority at the Veterans Affairs. She will give us a brief overview, and then we're going to open it up to questions and answers, inshallah.
Assalamu alaikum warahmatullahi wabarakatuh. Thank you so much for being on here right now and listening. I know medicine can be a bit boring when we start talking, but we kind of get excited about it. We apologize. So I'm gonna kind of make this short and sweet So Dr. Ilukpeju has done a beautiful job breaking it down for us. So I'll just let you know what the vaccine is all about, possible side effects too that you may come across, and that. So Zulika, can we have the first slide, please?
Sorry, my computer is frozen.
Excuse me?
Can you hear me?
I can hear you.
Okay, so my computer,
your computer is frozen?
Yeah, give me 1 second. Yeah, it's currently frozen. I'm sorry.
Alrighty, let's do this. Well, technology is a beautiful thing, but it does come with its own. Are you sharing?
It's spotlighting.
What is that? Okay. Let me share another screen then. Alrighty, sorry about that. Like I said, technology can be a bit finicky. We just have to take it with the good and the bad. All right, so second slide, please. I will share some brief facts with you. So we know that COVID-19, it is a fact. COVID-19 vaccine will not give you COVID-19 infection. And if you don't get anything from that, anything we say today, please make sure you get that fact. All right, and Dr. Ilukpeju already said that. Another fact is this: COVID-19 vaccines will not cause you to test positive on the viral test. And this is important because sometimes people get vaccinated and then they possibly get sick, like say a day or two later. That is because they possibly got the infection before they got vaccinated. And it takes about a couple of days, about 2 weeks or so, to build immunity to the vaccine. So once you get a vaccine, it often takes about 2 weeks or so. So that's an important fact too. And we talk about the COVID vaccine being an mRNA vaccine. It will not alter your DNA because they're two different things. And so that's another important fact. So you see, I have a strand. The next slide, please. I have a picture of an RNA and then a double-stranded DNA. So they're two different things. Dr. Ilukpeju already said this, so I just wanted to show you those pictures. So the COVID vaccine will not alter your DNA. So why should you trust the vaccine? Gosh, they've used us as guinea pigs for forever. So why should we trust them? Well, researchers, can we go to the next slide? Sorry about that. Sorry. Researchers have been studying and working with mRNA vaccines for decades. They've even used it in cancer research. So we know that we can possibly trust this, but everything in medicine is like, you take it like with a grain. Everything in medicine is not 100% foolproof, right? Medicine is a study. It's a practice. We learn as we go, and we should all help contribute to this learning process. So next slide, please. So still on that, right? They've tested this vaccine. It has gone through a rigorous study, even though it was done in a short amount of time. But they still followed the regular guidelines that they will do for other vaccines. So the flu vaccine we've come to trust, right? The yellow fever we used to get back in the days in Nigeria, right? They all went through different processes, and so did this one. And so, but what they did is that they did them sequentially, all about the same time. So you made it faster. So that's why it is faster. So next slide, please. Another fact is this: getting a COVID-19 vaccine can prevent you from getting seriously ill, even if you're exposed to the virus. And so that's one thing I wanted to make sure you know. Also, people who have gotten sick with COVID-19 in the past, they may still benefit from being vaccinated. Early evidence suggests that natural immunity from COVID-19, like if you got sick with COVID, it may not last for a long time. We've seen people that they got the COVID infection and they got reinfected, right? So it's not like, oh, I got this BCG as a child, I'm good. No, you possibly may need to get another vaccine. And we'll see if we will have to be getting this yearly, but only time will tell. you want to know that because we're Muslims, we want to know that the vaccine does not contain gelatin. So that's a big deal for a lot of people. And I looked through the ingredients and there's no gelatin. Good. And vaccine doses will be given to the American population at no cost. So you may get a charge. The vaccine is free, but people that are administering the vaccine may charge. And this will be covered by insurance. And if you don't have insurance, don't worry about that. The CARES Act is going to cover that too. Next slide, please. Oh, I think you went out ahead of me. Can we go back, please? Go back to the slide. Yeah, that one. All right. Oh, yeah, I'm sorry. Next slide. I apologize. Okay, so if I get the vaccine, what then, right? It usually takes about a few weeks to produce antibodies after getting vaccinated. So I already told you about that. Like some people are like, I'm never getting the flu shot. It was when I got the flu shot, I got sick. No, it wasn't the flu shot that made you sick. It was the fact that you possibly got infected before getting the flu shot. That's why you are sick. Or you got the flu shot, then you got exposed, and your body had not built antibodies to make you better. So that's why you got sick. So the vaccine will not make you sick. So you still have to continue to protect yourself while your body is building immunity. And so when does this really happen, right? Like he talked about, Dr. Lupe just said, we're going to, we have the two types of vaccines. We have the Moderna one and we have the Pfizer. On the Pfizer, you get it 3 weeks after the first dose. I got mine yesterday. The only side effect I can say is like my arm hurts a little bit, but it's all good. When I get the flu shot, the same happens. Then the Moderna, that one you get it 4 weeks later, so 28 days. They're basically fraternal twins. They do the same thing, right? So side effects wise, right? Muscle pain or injection site pain, like I said, some redness or swelling, fevers or chills, feeling tired, headache, joint pain, nausea, feeling unwell. And most of the side effects go away within 48 hours. So don't let me lie to you. The first dose, the side effects are usually not as much, but the second dose, the side effects may be more because that's when your body is actually really doing the work it's supposed to do, right? So sometimes after vaccination, the process of building immunity can cause symptoms such as fever and all the things I talked about. These symptoms are just normal, and they're a sign that the body is building immunity, is doing what we want it to do. Next slide, please. All righty, so after you get the vaccine, still, what are we gonna do? We already talked about you needing a second shot. So if you don't go back for so you get the first shot, you're like, oh, I got some side effects. I don't want to go back. If you don't go back, it's like, say you go on a bridge, right? You're trying to cross a river and you get on a bridge and you just go stat, and then the bridge stops halfway. You don't get to the other side. You don't achieve the goal. So if you don't get the second shot, you didn't get immunity, all right? So we all have to get the second shot. Then there's also something called V-Safe, right? This COVID vaccine is new, right? And so they have to continue to study it. And they want to make sure that you're doing well after you get the shot. There's like a smartphone-based tool app called V-Safe, where the CDC can check on you after you've gotten the vaccine. And they can also remind you to go back to get your second dose. So that's, once you get the vaccine, your provider will give you information about that tool. Or I got mine through the VA. So they gave me a VA number, but they will give you a follow-up number for somebody to check on you. If you have any side effects, you can report it and stuff like that. Next slide, final slide. So we've kind of talked a lot about COVID vaccine, and we are hearing there's a new one. There's a new strain in the United Kingdom. There's one in Nigeria. Oh my gosh, what is going on? Everybody is closing their borders and stuff. Well, yes, this new strain in the United Kingdom is something to worry about because it has multiple mutations, and it is just the last, let's just be real here, it's just the last tool. A virus is a last tool to show us his power, right? And we say we're smart, right? Allah says he does not give a disease without giving a cure. Well, yes, vaccine is possibly a means to an end to get to that reducing the possibility of getting the infection, but Allah will always do what he wants to do, right? So viruses mutate, that's what they're supposed to do. This strain is more transmittable, and so some COVID drugs don't work well against it. But the big question is this: will the vaccine work? Well, of the COVID vaccines that the FDA has approved, they produce antibodies that target several parts of the spike protein. So Dr. Ilukpeju has talked about the spike protein, which is the protein that allows the virus to get into your cells, right? So our vaccine produces several antibodies, right? So it doesn't, the virus will likely the vaccine should possibly still be in work for this virus, this new strain, but don't take my word for it. They're still testing. So it's not like it's 100% foolproof, but it should still work. So let's still kind of have some hope in that. And they're still doing studies. And if it doesn't, they'll let us know. But please remember that vaccines protect individuals and communities. Remember the yellow picture he showed you? Once you get vaccinated, you protect everybody around you. When enough people are vaccinated against a certain disease and develop immunity, the germs can travel as easily from person to person, and the entire immune community is less likely to get the disease. So please do your part. And if you have any questions, please drop them now. Thank you.
Thank you so much, both Dr. Ilukpeju as well as Dr. Okay, for such an informative presentation. I know I do see some hands raised and some questions. And I do want to, we're limited in time because we're supposed to start another session at 1:30. So I want to be mindful of that. So the first question that I see in the chat box, so ideally we're going to do 3 questions and then we're going to start the next session, inshallah. So if your question isn't answered in this session, inshallah, we can address it in the next session, or you can just drop it in the chat box and I'll relay that information to our presenters. But the first question that I see is, a report was analyzed in the UK saying that 30,000 patients infected with the vaccine, 300 were made not relevant to themselves out of side effects. So how do we know if this is negatively affect because B1 will not negatively affect B1 self? I don't know if the person who wrote that wants to unmute themselves and kind of clarify their question. Or Dr. Ilukpeju, Dr. Okay, I don't know if one of you want to answer that question. Or
Sorry, I don't understand that question.
Yeah, I responded to the person on the chat that what does she mean by
it's not clear.
Not relevant to themselves? I don't know what it means.
Okay, so we'll just go to the next question. The next question says, is there a sign that the mutated COVID-19 is worse than the COVID original? And they kind of, Dr. Okay kind of addressed that already, but I don't know if you want to say anything.
Yeah, what they're saying is yes, it's more transmittable. It's not saying it's more deadly. It's just that it can spread faster. So if you're not doing what you should be doing, washing your hands and all that good stuff, you can get it quickly.
Okay. So, awesome. All right, and I know 3 people have their hand raised, so we will address those 3 people. Apologies, I don't know if it's in the right order, but Princess Abiola, do you mind unmuting yourself to ask your question? And after these 3 people, we're gonna just take a quick break and then start the next session, inshallah.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much, Dr. Ilukpeju and my sister. My question is for Dr. Ilukpeju, because my sister already answered that question. Have you taken the vaccine? And if you have not taken it, are you going to take it?
Inshallah, I'm scheduled to take it on Monday. I was supposed to take it last Friday, but because of Juma, I couldn't make it. But this Monday, my name's on the list to get it, inshallah.
Okay, thank you.
But I did get the vaccine. I did say that. I got mine yesterday, so.
And then, so the next, brother Ibrahim Alaya, inshallah, do you want to ask your question?
Assalamu alaikum.
Wa alaikum.
My question is that when we already take the vaccine and we forgot that we took the vaccine, do we have to take it again? Because some people said, "Oh, I'm okay, I'm fine, I don't need the vaccine again." But later on, they wanna go somewhere. Oh, they'll just have the COVID already. That's my question.
Ibrahim, to answer your question, we don't know how the effect of these vaccines is going to last. We don't know how long it's going to last. That's number one. Number two, from the report we've got, people who have taken the vaccine, they've shown that they have antibodies produced, which they say could last more than 9 months. That's what they said. They're not sure yet the exact. So hopefully it will be longer than that. If it doesn't last more than a year, maybe, I'm just saying maybe now, it will be a part of the flu vaccine we get every year. Maybe they just add a little bit to the flu vaccine and just get one shot a year for both of them, possibly. But that's what I can tell you now, okay?
Okay. But thank you. Yeah, but what I'm saying is that the vaccine, is it going to be strong for our body that will not get the COVID?
Well, Brahim, for you, how old are you?
7.
Okay. Right now, the 2 vaccines we have, the one from Pfizer is for people who are 16 years old and above. And the one from Moderna is for 18 years old and above. They are testing the vaccine on children right now, and also on pregnant women right now. They are doing the testing right now. So we don't know the safety on those levels yet. I think it's probably safe, but we don't know yet until they come out with the results before we can say definitively, okay?
So we're gonna take Brother Hamid Shitu has his hand, no, Mansour Alajide, and then Hamid Shitu, and then we're gonna take a 2-minute break. And then if you do want to, you can stay on for the next session and ask your question, or you can just drop your question in the chat box and somebody will respond, inshallah. So.
Okay. I think I'm on now. Assalamu alaikum. Can you hear me?
Wa alaikum salam wa rahmatullah. Yes.
Okay, alhamdulillah. First of all, I'd like to say a big thank you to Dr. Ilupeju and Dr. Oke for the wonderful presentation, educating us more about the vaccines for COVID-19. That was very informative and helpful. My question to Haida, the presenter, is about alternative treatments for COVID-19. There is a lot of information out there. For example, using a cocktail of ginger, garlic, and some herbs, steaming your nose like 4 times a day. I'm sure we all get a whole bunch of that, you know, in the social media and elsewhere. So, but I'll just like to get their enlightened perspective and advice on such treatments. Assalamu alaikum.
I can totally take.
I would like Dr. Oke to answer that. She will be up to.
I do love it. I do love things like that, and I do use them. Interestingly, I'm a pharmacist, but I do believe in natural herbs that Allah has provided us with, right? So when it comes to steaming, all right, I don't know about that, but you know, it talks about the heat burning the virus in the mouth and all that. Before that, I don't know about that one, but when we talk about ginger, ginger is a natural antiviral. When we talk about black seed, the Prophet Muhammad sallallahu alaihi wasallam said, the black seed can cure any disease apart from death. So things like that, ginger, natural antiviral, garlic, not so sure. Honey is good. So there's certain things, and actually I made my own cocktail one time when I felt like, oh gosh, I'm having trouble breathing, and alhamdulillah, it helped, right? So just be very careful where you're getting your information from. And that's all I am. And if you know the doses you're taking, because these herbs can also, they're medicinal. So they have their doses. And if you take too much, it may affect something else. So I hope that was a good enough question, answer for you.
Jazakallah khair.
Alrighty. Jazakallah khair. Brother Hamid Shitu will be the last one, I promise. And then we're really going to take a 2-minute break, inshallah.
Bismillah. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa
So,
barakatuh.
Jazakumullah khairan. Very briefly, I have three questions. Number one, why do we have to renew vaccination like yearly? That's number one. Number two, from the study, and you guys mentioned that the mRNA has been in study for many years. Were there discoveries, side effects that thing didn't go well, was discovered and they were not exposing that? Was any, when you try new things, there are mistakes, there are, knowledge you gain from it, and you go back and so was there anything that they found that was wrong during the study of mRNA way of doing the vaccination? Number three is that people that got COVID, can't it develop this immune thing? Why that's not the case? Or maybe they do develop immunity, but I don't know. You guys, can you help me out with that? People that were affected and they got recovery, are they like people with vaccination or not? Are they still?
Alrighty.
Okay.
So, yeah, brother. Dr. Ilupeju, please go ahead. I was going to answer the two because I already did that during the presentation.
Yeah, go ahead.
So those two, yes, we talked about people that already got the COVID getting reinfected. So the built immunity, the immunity was just not long enough. Hence the reason why we possibly need a second dose and may need multiple doses for years to come. Does that make sense? Okay. All right, sir, you can go ahead and talk about the mRNA.
Well, the studies of mRNA has been going on for more than 10 years. The studies was not done to make vaccine when they were doing them. They were using them for looking for treatment for some other diseases like collagen diseases, cancers, and stuff like that. They've had some successes with some of them, not all of them, but there's no reported serious side effect or any issues with them. This is not gene splicing or gene relocation or stuff like that, which they use for people who have genetic disorder. It's a different thing completely. It's a completely different field. In those ones, they tamper with the DNA because they need to step something down or step it up. Maybe the baby who's sick is having some proteins which is not supposed to be producing, causing problems. So they look for the gene that produces that protein and change it. Those are different from this one. These are just things which, if they introduce in the body can build on its own to cure a particular disease. So it's a little different. So that's it. And the issue of taking vaccine again, the virus just do mutate constantly. That's with the cold virus we have every year. They are constantly mutating, and that's why they have to look for a kind of a cohort of them available in the environment and build vaccine based on those ones yearly. And that's the reason for that. There are about 6,000 species of influenza viruses all over the world, H1O, HN1, HN, so many of them. So if you don't capture the most popular one in an environment here, the vaccine is not going to work. And that's the reason why we do it every year. Okay. I hope we answer all the three questions.
Yeah,
I think you did. Jazakumullah khairan. Then sorry, what about exercise? Does that help in any shape or form? Exercising?
Exercising? Just exercising?
Yeah.
Exercising helps build your immunity. So exercising is good for a lot of things. It lets blood flow. So we should all participate in that. Right? Is that what you were asking?
So I think, alhamdulillah, jazakallah khair, both to you, both Dr. Lukweju and Dr. Okay. We're very grateful to have you as a source, a resource for our community. May Allah continue to increase you both in knowledge. May Allah continue to bless you both with the best in this life and the hereafter. May Allah allow the work that you do be a source of Jannah for you. May Allah grant you Jannah to Firdaus. Thank you everyone for joining us for this session. We apologize for the lateness. We're just gonna take a 2-minute break and we're gonna start this all over again. If you missed it or if you just joined us, we'll be redoing this session again and we're gonna start exactly at 1:36, inshallah. All right, so we'll be here. Join us or stay if you wanna stay for another session with us, inshallah.
Also, you guys are repeating the session?
Yes, we are. So ideally, the way it's structured, it's like in a traditional in-person health fair, you'd be able to go around to different booths and to listen to multiple sessions. So if you want to, you can leave and go to the mental health or nutrition session, or you can stay here and listen to the session again. And Wa alaikum salam. Dr. Lupeju?